Thank you, Mr. Chair, Your Excellencies, distinguished delegates, Lucy and representatives of affected communities, ladies and gentlemen, all of us have been saying that one of the key lessons learned in the fight against HIV and TB is that the two diseases need to be treated as a linked epidemic. So thank you to our friends at Stop TB, WHO, UNAIDS for convening this forum, and thank you, President Sampaio. Molto obrigado for your leadership. My focus will be on resources and on resource needs. First, to acknowledge progress and the remarkable increase in available resources that we have witnessed since the UNGAS of 2001. Remember, when all of us gathered at that time, there was no global fund. There was no PEPFAR. In less than 6 years, the Global Fund has become the primary multilateral funder of the fight against the three diseases. It has already committed $2.2 billion for TB programs and close to $9 billion for HIV programs in 133 countries, including the 22 countries with the highest TB burden and all countries with the highest HIV epidemic. Global Fund grants now provide 2/3 of global financing for TB and more than 20% of global financing for HIV programs. As Mark Dybul just said, PEPFAR, the US Presidential's Initiative on AIDS, the other major funder for AIDS, is also devoting now significant funding for TB. And there are indications that the availability of Global Fund grants has led to a revitalization of domestic TB programs and funding and has leveraged an increase in domestic funding. Global Fund supported programs have allowed more than 3.9 million people with TB to be treated under DOTS and 1.7 million people to access ARVs, close to 50 million people to access counseling and testing for HIV. But despite these results, more is needed. More is needed in terms of resources and, as my colleagues said, partnerships and health system strengthening. Resources need to be both expanded and need to be sustainable. This means increased resources from ODA, an increased proportion of ODA to be devoted to health. This means also involving other innovative financing mechanisms, either from the private sector, as we heard earlier today, such as the Red Product Initiative, or from the public sector, such as the Debt to Health Initiative, linking debt relief to investment in health, or UNITAID, of which the sustainable resources are largely dependent on airline ticket levy. Sustainability, which is key to funding, allows countries and allows the world for multi-year planning and more ambition in scaling up interventions. But sustainability is not only that of international funding. It is also needed at the country level through increased public investment in health. Let's remember, heads of African states committed in Abuja in 2001 to reach 15% of national budgets for health. And finally, sustainability at the country level is also dependent on guaranteeing solvability of the demand for health through free health packages or by subsidizing demand and or promoting prepayment and health and social protection schemes. So we at the Global Fund look forward very much to working with all of you to further assist countries in expanding and effectively utilizing all sources of finance. Thank you.